So this is just kind of an overview of how we can recognize pain signs in our companion animals, focus primarily on dogs and cats, but I have a little blurb for families that are with other species. When we recognize that pain, what we can do about it, and how we can feel empowered to treat their pain at home under the guidance of our veterinary team. So, really, every being on the planet experiences some level of pain. We're even learning that plants and mushrooms can exhibit signs of sensation that we could relate to pain. So it's a universal experience, and it's common for us as humans and for our animal companions, but we're all speaking different languages. Our body language is all different, our behavioral languages are all different, and sometimes that can make the translation of those pain signs between species difficult to notice and difficult to address. Mm. In many of our family companion species, the first species that comes to mind is kitty cats. The signs that they can exhibit can be very subtle and may get missed in our general life, in the hustle and the bustle, or may get mistranslated. Maybe their reluctance to be handled or pet or cuddle is pain related rather than them being angry at their parents or having a behavior change because something else is different in the home. So being able to at least recognize some of those more subtle signs can really guide us as their caregivers to meet those needs for them in a way that we may not have recognized without a little bit of extra training. So you'll see on the side of this slide, there's a little graphic that has some of the common signs of pain that you might notice in dogs and cats. Now, these could also be behavior changes, they could be stress related, they may not be directly related to pain, but they could be clues for us as their family to say, hey, I'm seeing several of these abnormal changes. Is this related to pain and how can we address it? And you'll probably notice if you can see that graphic okay, that there are some similarities, especially the decrease in social interaction. We can see them increased sleeping behaviors, we can see them exhibit reluctance to get up and move around, and those are kind of conserved or the same between many of our companion animal species. So cats confound us all the time as veterinarians and as cat parents. The signs that a cat is painful can just look like a normal cat who's resting and watching out the window or one that's sitting next to you on the couch. So this is just a little bit of quick training for us as cat caregivers on some of the facial signs that could indicate sudden or acute pain. Acute and chronic pain are very different, and how we manage them are very different. Chronic pain is a common problem in cats, especially related to arthritis. They are very prone to arthritis, and they are so good at adapting to that pain that they may not show us that it's hurting them. And it's really difficult to classify chronic pain in cats and to give a direct set of symptoms that indicate that pain, but we can classify acute or sudden pain, and that can count for chronic pain that is worsening. So if your kitty has arthritis and he jumps off of his cat tree and then suddenly doesn't want to move around the house or has a weird look on his face, that could be an indication that there's an acute episode of pain along with his normal chronic pain. And this graphic is a peer-reviewed, scientifically established way to measure acute pain in kitties. And you'll see in the bottom blue box, there's 5 things under each of those pictures and those facial drawings, and those are what's called action units or AUs. Those are things that you can look at in the expression of your kitty to determine if they might be showing signs of acute pain. And it's really related to how they're holding their ears, how they're holding their eyelids, how they're holding their cheeks and their whiskers. And once you watch your cat, you can pick up those really subtle changes in their facial structure and the way that they're holding their ears and their eyes and their mouth. And that could give you an idea that perhaps a dose of pain medication would be indicated for them. And these pain scoring tools, you can find pretty readily online, but I also have a link at the end of the presentation that's to one of our websites that has it compiled for families. So for kitties, it's hard to measure acute pain scientifically, but these acute pain scores can help us decide if a dose of emergency medication for pain control might be useful for that patient. For dogs, it may be a little bit easier because they are less subtle in their body language to pick up signs of pain. And of course, chronic pain in dogs is just as common as it is in cats and in humans. And arthritis pain is one of the things that we think about for chronic pain in dogs. The little graphic on this slide is actually one of the pain scales that we use in the veterinary hospital so that we can guide what medications our patients are getting depending on what surgery they had or what injuries they might have. These are easier to use in a hospital setting, but there's many, many pain scoring tools that you can use for your canine companions available, and there's be a list of those resources for you. The big takeaway for dogs is that just because they're not whining or crying does not mean that they are uh, pain-free. They don't have to be vocalizing to have pain. And in fact, in many dogs, vocalization associated with pain means that that pain is really bad. It's not just, oh my gosh, ouch, my knee hurts. It's, oh my gosh, my knee really, really hurts and I can't let you touch it and I can't stand on it. So whining and crying means significant pain, but it can be really hard to tease out whether that whining and crying is pain related or anxiety related or stress related. And that's where knowing them and their normal behaviors can be so helpful for us as caregivers to decide if that's an unusual sign. Do we need to address it as if it were pain? Other species, we're learning so much about pain identification in these species. But just real quick, birds that have any fluffed feathers in their posture, that's a concern that there's something going wrong with that bird, whether it's pain or illness, and they should likely be evaluated by a veterinarian. If they're not interacting with their cage mates or if they're avoiding interaction with their humans when normally they're very gregarious, those are reasons to have them evaluated for their pain. Reptiles, we are really stuck trying to translate their body language for pain to our language so that we can understand it. So right now for reptile pain, we assume that if it hurts us as a mammal or a dog or a cat as a mammal, then we have to address it as painful for that species too, even if we don't understand how they're exhibiting that or showing that pain to us. And small mammals like ferrets and guinea pigs and rabbits, they have a lot of the same pain signals that we can see in dogs and cats, but they might mix it up. They might use both dog and cat language to tell us about their pain. Rabbits are an exception with decreased appetite. If they have a decreased appetite, that can be a sign of pain, and the decreased appetite can itself be serious. So, with any of these birds, reptiles, small mammals, if we're concerned about pain or behavior changes, they should be evaluated by a veterinarian right away. So we have some quickie tools on behaviors or things that we can recognize that mean that our animal loved ones are painful, but what do we do about it? And one of the very biggest takeaways that I always relate to my clients and that I want to make very clear for us in this format as well is if you think that your animal loved one is painful, make sure that you're prepared to address that pain and make sure that you feel comfortable giving the medication for that pain. We would rather over treat pain than ignore it or not treat their discomfort because pain can be such a huge factor in overall comfort and quality of life. We want to make sure that we're thinking about it and we're addressing it. So it's always a good idea to ask your vet if you can get some rescue pain control, just in case, especially if you have a chronic illness or if your animal companion is going through something like arthritis or cancer treatment or has cancer that's not getting treated with advanced therapies. We want to make sure that any pain is well controlled, and having the power as their parents to give that medication at home without having to frantically try to get it can be really helpful. So being prepped with your veterinarian to have that ready to give. When you're giving pain medications, make sure that you only give medications that have been prescribed to your animal companion for the conditions that they have. Don't use the buprenorphine that your cat got for a dental cleaning 5 years ago today for their pain. It may not be appropriate, it may not be effective, it may be expired. And make sure that everybody who's taking care of your pet and you know which medications they're on, because some medications can be dangerous when given together. We don't want to accidentally give two that can counteract each other or can cause a totally separate problem. And then be really careful with over-the-counter pain medications. Many of them can be toxic to our animal companions. Even things that we would take regularly, like Tylenol and ibuprofen, can be life-threatening in certain doses for our animal companions. So if your vet didn't prescribe it or didn't recommend it, avoid it. And again, if you think they're painful and you have the means to give them that pain medication, go ahead and give it. We worry about side effects with pain medication like oversedation or sleepiness, sometimes nausea. Those are rarely serious and they usually go away once the medication is out of their system. So if you give a pain medication because you think that your animal companion is painful and they get really sleepy and wobbly on it, great. We know that that's a symptom that they have with that medication. How can we adjust their dose or adjust the medication? And that's a data point that you can relay to your veterinary team to kind of tailor the best pain treatment plan for your particular individual animal companion. We know all of us react to medications differently, and you just got to find the right set and the right timing for your loved one. Yeah. And so here's a quickie resource page that our pain management doctor, Dr. Earl, put together for her clients. And I think it's really helpful for any of us. It's free access. It has some of those pain scales if you'd like to evaluate those more and even try them with your own animal companions, and then relay that information to their veterinary teams, because it can be really helpful for us as doctors to hear from their parents how they're feeling at home and where you think that their pain is. That's it.